Are you considering moving abroad? Then healthcare should be one of the things that you consider before making an international move. And today I'm sharing with you some things that you might want to consider before moving overseas about healthcare. Hi friends, welcome back to the channel. Glad you're here with me this week. I do want to give a big disclaimer before we start the video, and that is the fact that I am not a doctor. I am not a doctor at all. I cannot give medical advice. I am not giving medical advice. I am sharing with you my personal experience after living in 2 different countries for the past 7 years of what the healthcare could be like overseas. And any issues that we talk about in this video, make sure you're also talking with your personal physician. All right, with the disclaimer out of the way, let's get into the video. I want to share with you guys some things that you need to think about around healthcare before you move abroad. And before we get into the video, please go below, hit that like button, and also importantly, that red subscribe button, because that way you'll be notified whenever I release a new video about expat life. And I'm also trying to hit 1,000 subscribers by the end of the year, and I've got about 50 more to go. So every subscription really helps out. All right, guys, let's talk about healthcare overseas. The first thing I want to talk about is a physical exam before you move abroad. Now, if you're moving abroad with your company, I've talked about this before. I will link a video up here for you guys to check out. You will probably require a physical exam because your employer wants to ensure you're healthy enough to move to that location. They don't want to send someone, especially to a more remote location, that's going to require some specific healthcare that's not available in that location. So be prepared to do a physical exam if you're moving with an employer. And if you're not moving with an employer, you're just moving on your own abroad, I still suggest getting a physical exam done before. I think most people don't want to arrive in a new country and have some kind of a medical emergency or learn that something is wrong with them that they didn't know about previously. So I definitely suggest getting a medical exam or a physical done before going overseas. I did one myself when I moved to both Angola and Argentina. They were pretty in-depth, everything from eye test to hearing test to an EKG to blood work. I had a whole host of immunizations done. So I think just getting a really good medical check with your personal physician before you move overseas is a good idea. Now let's talk about available healthcare facilities. So a question to ask yourself is going to be, is the country you're moving to more remote? And have you checked to see what kind of healthcare is available in that country should you require it? Now, this shouldn't be an issue if you're moving to a more westernized country or a country that's very similar to the one that you're currently living in. But if you're moving to a country that's very different or more lesser known or a much poorer country, then the available healthcare is something that you really want to research and look into. So before you move, you're going to want to understand exactly what healthcare facilities are available to you and what kind of healthcare you can expect to receive should you need it. And of course, none of us plans to get sick or need emergency surgery, but sometimes that can just happen. And it definitely happened to me when we lived in Buenos Aires in January of 2020. I was having some issues and I needed to go into the doctor, and it ended up being a hospital, and I had to get transferred between a few hospitals. I had to have a lot of tests done. People weren't quite sure what was going on, and different doctors had different opinions. And my naivety, I thought that the doctors would speak English, but nobody spoke English in either of the 2 hospitals that we went to, at least the people that we were working with. So Andrew and I really had to use our Spanish skills very carefully to figure out what they were saying, what they were recommending, what actions they were recommending we take. For a while there, for a few hours, I thought I was going to need surgery, and I was really stressed about that. But I ended up not needing surgery, and I ended up being okay. But it was just a very long day of a lot of tests, a lot of medicines, a lot of opinions. And I was just really scared throughout the majority of the process. And I only share this with you so that way you can be prepared in case an emergency happens to you as well. That way you're familiar with where you need to go or what's around you as far as healthcare. Luckily, we had a very good health insurance in Argentina, so we didn't have to worry. And if you're planning on moving overseas without health insurance, I highly recommend you look into getting some kind of an international plan to make sure that you and your family are covered. So in addition to checking what kind of healthcare is available in those countries, you're going to also want to see what those hospitals that you found are actually capable of. So sometimes you might have to be, depending on the country again, you might have to be life flighted to a different location to actually have surgeries completed, or depending on the medical emergency that's going on. When we lived in Luanda, I know of 2 people that actually had to get life flighted from Luanda to South Africa to have their appendix removed. So that's something that, at least in the US, that's a pretty common surgery. You wouldn't have to get life flighted anywhere. But in Luanda, they wanted to life flight them out. So that's something to just be more aware of, that just because you think something is a common surgery, it might not be something that you want to have done or that's able to be completed in that country. And again, this is where your medical insurance could really come in handy, because I imagine a helicopter ride from Angola to South Africa is going to be quite expensive, or whatever countries you're thinking about moving to. So that's something that might be included in your health insurance, and it might be a good idea to have that coverage. And don't forget about specialists. So hospitals aren't the only thing you're going to want to look for, or doctors in general. You're going to want to look for, maybe if you're female, an OBGYN. If you have children, a pediatrician. You'll want to look at the dentists that they have available, or an orthodontist if you have children that have braces. So those are things that you need to remember to be aware of also before you move abroad. Children's considerations. Now, I probably don't need to remind you about your children, of course, but just again, it's a short reminder that you're going to want to make sure whatever healthcare that you want available for your children are available in the country you're considering moving to. So again, this will consider pediatricians and the kind of care that they can give, or maybe your children needs to see a hearing specialist every year to have a hearing test done. That's something that you're going to want to ensure the country you're moving to has available to you. Another thing to consider is going to be if your children has special needs in the classroom, you're going to want to make sure that the schools you're considering in your new potential country has the capabilities and the services that you expect or need for your child to learn. So that's something else to keep in mind as well. I will say, when it comes to children, I didn't have any when we lived overseas myself, but I did have a lot of friends that had children. And typically what they did was they waited until the school year was out, or they had a school break, whether it was summer break or winter break, and they would actually go home to visit friends and family. And then that's where they would have their yearly checkups done, whether it was a pediatrician or a dentist. So that's something else to consider, that you might be coming home a lot to do some of the regular appointments for your children. But again, I would think that you would just want to make sure that there is some kind of healthcare there in case there is an emergency. Prescriptions. So prescriptions are something that I would suggest filling as much as possible before you move abroad. So if you're taking a prescription and you can get 6 months at a time, I would get the 6 months, or however many months you're able to fill it for, I would get the max amount. That way it'll give you plenty of time to kind of get used to life in your new country and try and find a medicine that is the same medicine over there. If you can't find the exact same, then maybe you can find a similar brand in that country that works the same way. Or another option is to also find someone that is traveling back to the US and see if they can bring back your prescription for you. I know we did that a lot when, not us personally, but we heard of a lot of people doing that overseas. They would look for someone that was going back. They would have a family member go to that person's house or that person's hotel and actually give them the prescription to bring back in their suitcase with them. So moving abroad doesn't mean you have to stop taking your prescriptions. It just means that you have to get a little creative. Local diseases. So this is something that you might need to be aware of before you move abroad. There's a chance, depending on what country you're moving to, that they have some diseases that you're not used to in your home country. And for us, that was malaria. When we moved to Angola, we were very well aware that malaria was a big issue in Angola. It kills thousands of people every year there, but we don't have to worry about it here in the United States. So that's something that we needed to be aware of, and we were definitely made aware of that before we decided to move to Angola. And a lot of these diseases are very dangerous. In fact, we knew several expats that caught malaria while we were there, and they had to be hospitalized for several weeks. So it is definitely a serious issue that you need to be aware of. You should know any kind of diseases that you are at risk for before you move abroad. You should understand the risks, and you should really consider that before you choose what country you're moving to. All right, prevention measures. So if there are any local diseases such as malaria in the new country that you're moving to, you might need to take some measures to ensure your health. So again, depending on what the disease is in the country that you're moving to, you might require some immunizations. So we had to get several immunizations before we moved to Angola. And the one that was absolutely required by the government was the yellow fever immunization. And because malaria was so common in Angola, a lot of expats used malaria pills. I'll just call them that. I don't know the scientific name. I'll probably write them up here on the screen. But I personally tried to take them when we first moved there. I think I got a week into the pack and my stomach was hurting. I didn't feel good. So I decided to stop taking them, and I did not take malaria pills while we were there. But again, I suggest you talk to your doctor about what options you can do to prevent malaria. I'm just giving you my own personal experience. And what I found to work the best was honestly mosquito spray. We would always make sure we had some with us. We would put them in our suitcase in the US and bring them over. I also had DEET mosquito spray, so it wasn't all natural or anything. It had the DEET in it. I found that to be the most effective against mosquitoes there because the mosquitoes were really, really bad. I'm not going to sugarcoat it. The mosquitoes were terrible. So every time I left the house, whether it was going out to dinner, going grocery shopping sometimes, I would typically spray myself really quickly. And then if I knew I was going to be spending an extended amount of time, I would really try and do a good spray, even in my hair sometimes and all over down my legs, by my ankles. So that way the mosquitoes wouldn't get me. There's all kinds of different things you can do. Maybe it's mosquito nets, bed nets. A lot of expats use those as well. We tried to keep our house very chilly because that way they wouldn't attract mosquitoes inside the house. So again, these are malaria preventions, but depending on the country you're moving to, there might be different types of prevention methods you can use for yourself. I definitely recommend doing your research and figuring out what prevention measures you're going to take, and then take them very seriously. And the last thing I'm going to touch on very briefly is going to be the COVID vaccine. I'm assuming that most countries are going to start requiring them for people to move there or to visit the country. So that's something that you're probably going to need to get. Again, just check the country entry requirements before you do that. But it's something that's probably going to become more prevalent in our post-pandemic world. All right, friends, there are so many things that you have to think about when it comes to healthcare and moving abroad. But I hope this video just gave you a quick general list, and from there you can kind of take offshoots and figure out exactly what your healthcare needs are for you and your family. Remember, when it comes to your healthcare, you do not want to guess. You want to do extensive research, really understand what's going to be available to you in your new country, and then make a plan. All right, friends, I will see you next week with another expat related video. Bye.